Hello, welcome to another exciting edition of Nurse News Analysis. Today, I have with me Nurse Kimberly Overton, who is the founder of Remnant Healthcare and Nurse Freedom Network. And then you have me, Jodi O'Malley, your lovely HHS federal vaccine nurse whistleblower. I get a few updates on my case that I want to share with you guys, but we want to talk about some topics that are in the news. CDC just released new guidelines for respiratory illnesses. Interesting that, they're putting COVID in with all respiratory illnesses, right? They don't want to come out and say COVID-19 guidelines, but they do get a little specific, and we will opine on that. We're also going to talk about another topic, which I believe we're going to see more and more of, and that is Mount Sinai was fined $2 million for unsafe nurse staffing. I cannot wait to get into that topic with Kimberly, because we have a lot to say about that. And then also, too, I did a post on my Instagram asking nurses for their opinions on how to keep nurses in the profession. And I was overloaded with comments. So I want to share some of those with you. But first, let's welcome Nurse Kimberly Overton. Thank you for joining me, love.
Of course. Thank you, Jodi. Always a pleasure.
Yeah. So which topic you want to get into first?
Oh, there's so many to choose from. I mean, there's just so many. Let's talk about the safe staffing.
Yeah. So Mount Sinai is ordered to pay $2 million for chronic nurse understaffing. So in a sense, these nurses are going to get a monetary award for risking their license every time they walk in. It says here in this article that Mount Sinai is being ordered to pay over $2 million to its nurses at 3 hospitals for chronic understaffing. An outside arbitrator found that the nurses at Mount Sinai Morningside, Mount Sinai West, and Mount Sinai Hospital were forced to work understaffed shifts in an emergency room, labor and delivery, and oncology unit. Last year, the Mount Sinai nurses went on strike, citing understaffing as a major and chronic issue that could lead to burnout and poor patient care, and won a new union agreement after 3 days, which included financial penalties if they continue to insufficiently staff shifts. Well, guess what? They continue to do that.
Shocking.
And shocking, right? And they said here that they were fined a historic $127,000 penalty for persistently understaffing a neonatal intensive care unit. We will get into more, but Kimberly, I mean, is this shocking to anybody?
No.
No.
No. I mean, safe staffing has been an issue that has plagued our profession for decades.
Mm-hmm.
For decades. So this is not anything new. It's certainly not anything new to COVID. I think we maybe talked about that a little bit earlier, where we were discussing that, this system has been broken long before COVID. But it was really just COVID that opened so many eyes and shined a light onto what has been happening for so long. I'm honestly surprised that they did win, because
Mm-hmm.
I'm almost shocked that they didn't turn around and kind of, the nurses are always the scapegoat.
Yeah.
And I'm surprised that they didn't say, well, you accepted the assignments, which is true.
Yeah, so let's talk about that to our listeners out there. A safe staffing in an ICU unit is typically 1 to 2, 1 nurse to 2 patients, maximum 3 if they're not that critical. On a nursing unit, med surge, which is where most of your patients go to in a hospital, after surgery, if they need IV, wound care, that type of stuff. That is typically 1 to 4 on day shift and maximum 1 to 6 on night shift. And so, when we're talking about it, they say that nurses were having to work, and get this, 1 nurse to 22 patients.
On a floor?
Yes.
Not in a like a sniff or anything. This is on a floor.
Yep, in the hospital. Yeah.
Then yeah, there would be no way I would have accepted that assignment. Absolutely not.
Well,
So
yeah, let's talk about accepting the assignment a little bit. What does that mean?
yeah, well, so when you go in for your shift, you go in and you'll get report. Now, once you clock in, there's so much confusion about whether when you clock in and then you take report. When you clock in and you take report on the patient, that patient is then your responsibility.
Right.
If you don't clock in and you look and see what the assignment is going to be, you can say, I'm not going to take that assignment. This is not a safe assignment. And you can talk to the charge nurse and see if they can, shift something around. But once you clock in and you take and actually get report on a patient, that patient is then your responsibility. And you are, until your shift is over and your replacement is there, you are responsible for that patient and anything that happens to them under your licensure.
Right, which means that you cannot leave until
Correct.
you give report to another nurse. And they're also finding that nurses were having to work 16 and 18 hours because there were no nurses to come in and give report to.
Right.
It just, they say that it's a major and chronic issue that could lead to burnout and poor patient care. Now, I hate when they say burnout, because that makes it look like, we're just trying so hard and we just can't take it anymore. As nurses, why are we allowing ourselves to get burnt out to begin with?
Exactly. I cannot imagine going onto a floor and get the highest patient ratio I ever took was 1 to 8. And I was not happy about it at all. I was actually floated. It was my first time being floated. I was a brand new nurse, Jodi. I was 6 months post-graduation. I was an ICU nurse.
Wow.
And I think they think, I never went to med surg. I only worked in CV ICU and then I worked in ICU and progressive care units. I never worked like med surg other than when I was floated.
Yeah.
And so it was my very first time ever being floated off of orientation. And they gave me 8 patients. One of them did not have any IV access and like a blood pressure of like 79/30 or something insane with, again, no IV access to fix them.
Yeah.
So I complained about that assignment, but I ultimately accepted it. And, everything ended up working out okay. I got the IV access. We took care of everything. Nobody died, thank God. But even just 8 patients to 1 nurse. And listen, 6 months out of nursing school, you don't even know what you don't know at that point. You're still very much a baby nurse. And you really need to have support. So to me, that was a completely unsafe assignment. And I actually kicked myself for even having accepted it. But it's difficult. And especially as a newer nurse, to, be like, I'm just not going to take that. I don't feel comfortable. And they're constantly gaslighting us as nurses. You can't even, they give us PTO and then they don't let you take it. They make you feel guilty for trying to take a day off because they're always so chronically understaffed.
Right. Yeah. Cheryl Ostroff, a registered nurse of 21 years at Mount Sinai Emergency Department, said, I've had nurses calling me in tears because they had to walk by a patient they haven't seen in 2 hours.
Yeah.
They feel like they let themselves and their patients down when it is the hospital that has let us down. We hope this decision will finally force Mount Sinai to provide us with staffing levels nurses and our patients deserve. It just, to me, is like, why would nurses continue to allow that to happen? When, as a nurse, like we had talked about before, we get into this profession because we love it and we love people and we love medicine and science. and we want to help people. But the fact that they think so little of themselves that they are supposed to like work themselves into the ground
Yeah.
and put other patients at risk instead of saying, no, no, you have got to get more people here. You know what I mean? Like,
Yeah.
even having another nurse float from another department, that nurse can look at IVs, they can do pain potty position on patients, they can look up orders, they can be a resource nurse.
Right. And something to remember too about, especially on night shift, you don't always have
Mhm.
techs on
Right,
night shift. So
right,
day shift is a little bit easier because you do have your CNAs and your techs that are there to provide a lot of that support and patient care. But a lot of hospitals do not staff techs at night. A lot of
right,
ICU don't use techs at all. We never use techs. So
right,
it's a whole different, ball game. And it is extremely unsafe for these patients. And it does really hurt a nurse to her core when she can't meet the needs of her patients.
right, right. When you have that antibiotic that was due and you're 3, 4 hours overdue from giving it, or
Right.
the patient that needs pain medication and you can't get into the room because you're busy cleaning up another patient who's been sitting in their feces for 2 hours. You
Yeah.
know, it's horrible. And then they say, go on to say that Mount Sinai CEO Kenneth Davis was paid an eye-watering 5.56 million by the nonprofit institution in 2021. And then last year, he got a 1 million pay bump, bringing home $6.7 million in 22.
And for what? Because he can't even provide safe patient care. What are
And
you paying for?
right, and we know this, right? But we continue to show up and show out. And nurses, I'm going to speak to you directly, nurse. I mean, if you are thinking that your hospital is not going to function if you don't show up to work, then I mean, you're not looking at the bigger picture here. This is a group effort, a team effort. We have got to be resources to one another and twist the hospital's arm at making sure that they have nurses on backup that they can call, nurses on call. You know, they don't want to do that because they have to pay them, you know, an hourly rate, which is literally like $5 an hour, right? I mean, it's
Right.
nothing when you're sitting at home and you're bumped back waiting, you know, because typically what could happen is if you are scheduled for a shift, let's say, and there's not enough patients, okay, to, you know, bring in that many nurses that are scheduled, the charge nurse will call you up at like 5 in the morning or 4 or 5 p.m. in the evening, if you're day shift or night shift, and they will say, you know, that we are putting you on standby. So typically standby is about 4 hours. So you have to wait around and see if they call you to come in. When they do that, even the $5 an hour, you know, it adds up for them. And then your CEO, Kenneth Davis, isn't going to make $6.7 million. He might make 6 million, but is he willing to, you know, say like, what kind of leader is this Kenneth Davis? Obviously not a good one.
Where are the managers? Where are the nurse managers? Why aren't they coming on the floors?
Right.
You
Right.
know,
Yeah.
I mean,
Yeah.
they're all your managers are nurses. They are all RNs. So why aren't you
Mhm.
getting your butt on the floor and helping your staff?
Right. Yeah. I mean, obviously they're making money on the patients that are there. They, you know, they have the demand for the patient. So all they needed to supply is the workers.
Yeah.
So hospital officials testified to their tireless efforts to recruit nurses, adding that
That's
it,
before or after they fired them for not getting.
oh, you know where I'm going with this. This
Mm.
paragraph, you're going to love it. Listen to this. Oh, adding that a designated recruiter is assigned to the emergency department. So they have their own recruiter just to get, nurses to work in the emergency department. But the arbitrator noted that the number of external hires touted by Mount Sinai, so they, got a bunch of nurses to come on board, was essentially negated by terminations or transfers out of the emergency department. So why are they terminating that many nurses? I wonder. What do you think?
I don't know. Maybe they just didn't want to like inject themselves with some kind of,
Yeah,
untested product.
experiment.
Maybe. I don't know.
Mm-hmm.
Maybe it's like being a lab rat. I don't know.
Yeah.
Something like
So
that.
so the nurses that said, I am not going to participate in this experiment, were fired.
Mhm.
And they thought that they were going to bring in that many other nurses to, to kind of balance the two out. But obviously, they had nurses that weren't happy. They say nurses transferred out of the emergency department. I'll tell you this, if a nurse leaves an emergency department, she doesn't go to ICU, she doesn't go to med surg, she doesn't go to tele, she goes to the cath lab. You know what I mean? You only
Mhm.
have one cath lab in the hospital. So there's not like there's a lot of nurses that are leaving the ER to go to the cath lab. You know
Yeah.
what I'm saying? Or they'll go to the PACU, post anesthesia care unit.
I
And
love
again,
PACU.
right, you don't have that many people that, that the need for PACU, because most nurses that work in the OR, either the OR pre-op, right, preoperative, and post anesthesia care unit, they stay there because that is, the usual 9 to 5, with picking up maybe 5, on call shifts a month or something. So it's not like these nurses, are leaving to go, staff the hospital in the other areas.
Right.
Yeah. Yeah. And you know what? I mean, I think that, I realized this last night when I was looking at my Facebook memories that we are celebrating. If this, I mean, it's kind of a celebration to me, celebrating 4 years since the beginning of COVID.
Yeah. Oh, wow. You're right.
Yeah.
Unbelievable that it's been, wow. You're right.
Unbelievable that it's been
4 years.
4 years, girl. Oh my
Like part
God.
of me feels like it was just yesterday, and then part of me feels like it was like 3 decades ago. I mean, it's insane. It's just complete insanity. But I mean, I so much of it because I think many of us have some severe PTSD from what we went through in the beginning of the pandemic. I think there was a lot of fear, even among
Mhm.
those. We figured it out pretty quickly, but in the very beginning, I can remember, sleeping in a camper for 2 weeks. In the very beginning of the pandemic, somebody had donated a trailer, a camper to me, because I wasn't afraid of COVID myself, but I was afraid of giving it to Billy, my husband,
Mhm.
who likely would not have survived.
Mhm.
Or so I thought. He actually did better than I did with COVID, believe it or not. He wasn't in great health, but he was a smoker. And
Right.
that's a whole other issue, and what nicotine did to offer protective um,
Right. Because
measures.
nicotine that binds to the spike protein, right? Spike
Yep.
protein, or is it or the ACE2
The ACE
receptor?
two.
Yeah,
The
the
ACE.
ACE2 receptor. Yep. Yep.
So interestingly enough, he actually fared a little bit, he did fine. But at the time, I didn't know. I was just scared to death that I was going to give him this virus that they say is just killing everybody. He wasn't in good health. And I was like, oh my God, I can't. So I'm sleeping in a camper in my driveway for
Mhm.
2 weeks. And then, my husband and I had a conversation, and we were like, how long are we going to do this for? It doesn't make any sense. We didn't want to live life that way, live in a spirit of fear, and be 6 feet apart from one another. So we gave it to God, and we
Mhm.
said, thank you very much for the loan, and I'm going home.
Yeah.
And everything worked out just fine. But yeah, early on, we were all very, very frightened, I think. And, they really did a lot. If you remember the death tickers,
Death toll
um,
ticker. Yep.
the death toll tickers on and talking about how overwhelmed the hospitals were. I don't recall that myself, but
But they were
you know,
dead. Most hospitals were dead because
the
they
only
shut down
time
surgery.
Yeah, they shut down same day surgery. The only time I remember the hospital really getting full was around December, January 2021, and we all know what happened during that time frame, right?
Yeah. Yeah.
When
So
the
for
vaccine
you,
rolled out.
you didn't see your first rise in cases until December, January, 2020,
Right.
21. Yeah.
Right. So it was interesting. We started to see like our ICU would get full of very sick patients, but they weren't sick with COVID. These
Hmm.
were patients that were letting their, their CHF or their COPD or their diabetes, they were letting all of their chronic illnesses go, and they weren't coming to the hospital because the news, had everybody so afraid to go into the hospital. They had them afraid to breathe air. So they
Right.
certainly didn't want to come into a hospital where COVID was lingering everywhere. So
Hmm.
people weren't getting the treatment that they needed. And so by the time that they would get to us in the hospital, a lot of times it was really too late for us to, reverse the
To help
trajectory.
them.
Yeah.
Yeah, for me, at the Native American hospital, our first wave of admissions was in June and July of 2020. And you know what came prior to that? No, you
Mm.
probably wouldn't. But the reservation, the president of the Navajo Nation locked them down. They locked them down in June and said, you guys cannot leave, right? We're not allowing anybody to come on the reservation or and here's the thing, a lot of people in that worked at Phoenix Indian Medical Center have homes on the reservation. So they would do their shifts and then they would go home and see their families. And this was a common occurrence. I mean, in my hospital, a lot of people were related to each other, or a lot of people have known each other for their whole lives,
Yeah.
and so when they locked down the reservation and then they were essentially quarantining, isolating the healthy with the sick in these multi-generational households with no running water or electricity. Well, I believe the pastor said there's over 70%, 80% of homes on the reservation have no running water or electricity. And grandma lives with their great great grandchild. You know what I mean? And so if somebody got sick, and remember, we also told people not to open the windows. We put on caution tape on the playgrounds.
Yes, I
We
remember that.
closed down schools.
Yeah.
Yeah. I mean, I think that,
We put those one-way arrows on the grocery store.
yeah. And then mask. And, I think given that talking about this for a few minutes is very valid because all of this happened, guys. And, I mean, for me, I had gotten sick in February 19th. I came down with what I thought was the flu, but I had extreme shortness of breath. And I received, after a few days of withering around in the bed from muscle aches and coughing and an inability to breathe, I received the Z-Pack, an antibiotic, and steroids. And immediately within like 12 hours, I turned around. So I don't know exactly what I had, but the Lord just came over me and was just like, oh my gosh, the whole world's shutting down. And I just vowed at that time that I was going to choose faith and not fear. And that's what led me to investigate public health policy. Like, is this something that we ever, have done? And it wasn't, and then they put the mask on, and to go down that rabbit hole, which, is still a thorn in my side when I see people wearing them. But yeah, it's the whole narrative. So yes, guys, this is 4 years from the time that they put COVID on the world, right? And this was, I believe, 100%, this was this was
Oh,
planned.
absolutely. Event 201. When was that? Right before
September
September?
2019. Yeah.
Mhm.
Yeah.
Yeah. I mean, it's they don't even hide it. They literally don't even hide what they're going to do, and it's all out there in the open.
It is.
They're coming back, and they're coming back to do God, Lord knows, disease X or whatever is coming down the pike. I just try to ignore them at this point and not just give them any energy.
Well, what do you think, Kimberly? Because we had a talk in the ER last night when I was working, and a doctor said they started talking about Trump, and they said the doctor said I had a lot of conservatives that I knew that were not voting for him because they thought he was a misogynist and a criminal and stuff, and he said, but they're going to vote for him this year.
Yeah, I think, I was a Trump supporter. I will still vote for him if he's the eventual nominee. I will vote for him, of course.
Right.
Um, but at the same time, I have to voice my disappointment. Because and not so much about Operation Warp Speed. Um, I can give him fog of war, and he's not a doctor. He's listening to the doctors. I can give him all of that. But
Right.
at this point, I really wish that he would do a mea culpa. And I know that's really difficult for him, right? And
Mm-hmm.
I mean, I love Trump, but he's very, he has a big egotist. He's very
He's
egotistical.
yeah, completely
I
egotistical. Yeah.
fine, right? I
Mm-hmm.
didn't care. I love the way he ran the country. Um, but I'm very disappointed, and I don't mind saying that I'm disappointed that he hasn't spoken up, and about the vaccine injured, and about people are getting boosters, and he's not really talking about that. People are dropping dead every day, and I've heard people, friends of mine that are very hardcore Trump supporters, that have said, well, it's not really politically, it's not a good political move for him.
Well, and that's what I'm wondering. I'm wondering if he is tabling that and he's like, okay, I cannot make that, profound change if I'm not president.
Right.
I want to think that he would come into office and clean it up, right? Which, I mean, hindsight's 2020. Fire every single Obama, Biden, person in the government,
Yeah.
and bring in your own people and do it right. Hopefully, Bobby Kennedy has something to do with it because he's real big on medical freedom and calling out vaccine injuries and educating and stuff on his CHD TV.
And what I'd like to see, I don't like the fact that they should have given Bobby the Democratic nomination. I would like to see the race between Bobby Kennedy and Donald Trump, because we'd be in a win-win situation. I could live with either one of them, honestly, being president, because I think both of them would do a decent job.
Yeah.
And to me, America wins whichever one of those two gets in.
Mm-hmm.
Um, but obviously that's not gonna be the case. But
Yeah. I mean,
what do
we'll
you think
see
about
what.
what do you think about a Trump Kennedy ticket?
Well, you know what? What do I think about a Trump Kennedy ticket? Well, I will weigh in on that after we come back from break. Because I have to pay attention to the time and our show
That would be a
sponsor.
long conversation. I feel it.
Well, America Out Loud dot shop has an amazing line of different products, guys. And if you go there, you will get the code for discounts only available to America Out Loud Talk Radio listeners. I also like to tell people to download the America Out Loud Talk Radio app. That's what I do. I have the app on my phone, and then 24/7, you can click on that and listen to an amazing, different host on a variety of different topics, from attorneys to doctors to constitutionalists. And then, of course, Nurses Out Loud, we air Monday through Friday at 10 a.m. Eastern time, and all of our shows go to podcast. So I encourage you guys to like, share, subscribe to whatever channel you're listening to us on, and comment. Please give a review and share our shows. And check out ASEA Redox self-signaling supplement. I really like taking or using their. I didn't even tell you this, Kimberly. My hands, when I started working in the ER, and having to use the hand sanitizer all the time, I started developing what I thought was eczema on my palms. And it was just being dry in places.
Hand sanitizer.
Yeah. And I think my hands were just like, oh, you haven't used this for 2.5 years. We're not used to it. And the doctors think that it was just like a contact dermatitis kind of thing, and which is inflammation of the skin. And I used the Redox gel while I was at work last night, and I looks like it's not so red and inflamed anymore. So anyway, guys, check out americaoutloud.shop, and we will see you on the other side of this break. Stay tuned. All right, welcome back. Thank you for joining us on Nurses Out Loud. I'm your host, Nurse Jodi O'Malley, and I have Nurse Kimberly Overton, who is your Wednesday host and also founder of Remnant Healthcare and Nurse Freedom Network. So guys, in the beginning, the first half of the show, we talked about Mount Sinai having to pay its nurses. And I don't even know how many nurses are in this lawsuit, that their $2 million is going to go very far, but hopefully they make changes there and nurses understand that they do have other alternatives, which I do want to talk about real quick. We are bringing in to the Nurses Out Loud group Melissa Schreibfeder, who is the owner of Functional Nurse Academy, and they just received accreditation for functional nurse medicine practitioner with the American Holistic Wellness Association. All of Kimberly's nurses at Remnant Healthcare are trained in functional medicine, and this is just an amazing what the nurses are doing. I just want to let you guys know that you do not have to stay in the system, being overworked, not understanding, what you're walking into or when you're going to be able to leave. And I know many of you, your eyes are open to big pharma's control over healthcare, which is really sick care. We don't try to get people healthy. We just give pharmaceuticals to mask their symptoms. And functional medicine is a way to get to the root cause of whatever it is that's ailing you. And Functional Nurse Academy has teamed up with Remnant Healthcare to supply the education to the nurses. And Kimberly, Remnant Healthcare is where the nurses can take on patient loads as they come in. And for you, our listeners, you want a nurse in your back pocket. You want a nurse that is going to help drive your healing. You can get blocks of time for patient advocacy, for hormones, for weight loss, for, blood pressure, whatever it is. We're able to, team you up with the nurse that, is specializing in that area. And also to Kimberly, talk about you bringing in other healthcare providers, because this is amazing, guys. We have a lot coming down the pike to share with you on what the revolution that we're wanting to create.
Yeah, I'm really excited about this. We've always been welcoming to other disciplines, but unfortunately, the name Remnant Nursing really didn't suggest that. So we decided to do a rebrand to Remnant Healthcare to make sure that people know that there's a place for them at Remnant Healthcare. So we are welcoming in nurses, doctors, physical therapists, speech therapists, occupational therapists. Listen, I only wanted to take care of the nursing part of this when I first started, but hey, somebody's got to do it, right? So we're gonna go out there and do it. We hear a lot of people talking about, we need a parallel society, and parallel healthcare system, and we absolutely do. But let's stop talking about it and let's start doing it. So hopefully others will start following suit. There are other people that are out there that are starting to make these little pockets of this parallel system in healthcare. And, I don't believe in, this about me, Jodi, I don't believe in competition. I believe in collaboration. So if there are other people that are out there that are doing good work, I will support that 1,000%. And whatever we can do at Remnant to come alongside of them, we're open to that. We're 100% open to it.
Well, that's it. I mean, what do we have? 4 million nurses, 5 million nurses, 5 million nurses. And so there's a lot of you guys. I mean, we interview you on Nurses Out Loud and promote what it is that you're doing, because we know, like, we can't take care of all these patients on our own,
No,
right?
no way.
And, people are doing amazing works, and, and it's important to support one another. This isn't a nurse eating her young kind of thing. We want to support you, new
Yeah.
nurses as well. The nurses that graduated and have been working for a year or two, and they're like, screw nursing, I don't want to do it anymore. Well,
Yeah.
we want you to check out what Remnant Healthcare is doing. You can go to remnanthealthcare.org, and also check out Functional Nurse Academy. Up until the March 15th, yeah, Melissa is offering $200 off of her really low priced accreditation program, guys.
Yeah, it's so affordable all on its own, even before you get to the discount. This program
Yeah,
is so undervalued for what you get for it.
right.
It's
And it won't remain
affordable.
that way for long.
No, it
No,
won't.
no,
And it shouldn't. In all honesty, it shouldn't,
right.
because what she's offering is absolutely incredible.
Yeah, it's incredible. So I am going to put the link in for the sign up on March 11th. She is hosting a live Q&A, which will take you to the back of her, or to her course platform, so you can see what it entails, and also the toolkit that you get with it. And I'll put that link in the show notes for all of you nurses that want to, be nurse entrepreneurs, because that's what Kimberly is offering to you guys under Remnant Healthcare. So check out both of them, and I will put links to them in the show notes. And yeah, so that's really exciting. But you did ask me, what do I think about a Trump Kennedy ticket?
What do you think about that?
Oh, girl, I think that's amazing. I think
I
it's
would love it.
I would
Personally, I would
love
love
it.
it. Are you kidding? I would love that. Now, I don't know how either of them would feel about it, but I don't even know if they like each other, but
I'm sure they do. I'm sure they know about each other. Absolutely. I don't know. I think it would be amazing. I think Kennedy could really help transform the NIH and, the CDC not working. He understands the corruption in
yes.
the three-letter agencies. He talks about it in his book, The Real Anthony Fauci. And which other one did I get? Oh, and then I just got this Vax Unvax book by
Yeah, Brian Hooker.
Yeah.
Just, by the way, just absolutely amazing. I love Dr. Hooker. He'll be at Next Steps, by the way.
Oh, good. Yeah, talk
Yes.
about next steps real quick.
Yeah. So Next Steps, we're going to be down in Beaufort, Georgia. It's an incredible event. It's going to be a 4-day just infusion of hope and encouragement, and really focusing on building this parallel society, and not just in healthcare, but across all facets of society. So education, healthcare, financial, all of it is these are the doers, the people that are building this parallel society that we're all talking about. But these are the people that are actually taking the steps to make it happen, and it's bringing everybody together. So if you're looking for a community to build with, this is an event you do not want to miss. And like I said, Dr. Brian Hooker will be there. You will be there, Jodi. Nurse Michelle will be there as well. We're also bringing in the family of Autumn Shaw, 4-year-old Autumn Shaw that we advocated for at Remnant. We're going to introduce them to the team that advocated on their behalf. So we're really excited about that. And also holding a free events for the public, a forum that's going to be discussing your options as far as advocacy and how to advocate for yourself and your loved ones due to the medical kidnapping crisis that we have in this country.
Yes, girl.
Go to next-steps.info before I forget to say that.
Yeah, and Remnant 25.
Yes, thank you. Remnant 25 will get you 25% off of your admission.
Yes. So that is, again, say the dates.
It's March 14th to March 17th. It's in Beaufort, Georgia. Fly in, drive in. It's going to be an incredible opportunity to network with other nurses. We're going to do a whole presentation on Remnant Healthcare and how you can get involved and how you can start to earn money and become part of this incredible team and this incredible parallel healthcare society that we are building.
Yes. And these events always leave you uplifted. I
Right.
don't know if any of you guys, and probably many of you listening, have done some type of MLM. Well, how when they have their annual meetups and they like pump you up, and then you're all excited and you go home and you tell your family and your friends why they must join.
Mhm.
Well, this is that type of feeling and excitement, but it's actually educational, it's healing, new friendships are formed. Maybe, if you're out there looking for a partner, maybe you find one at this event. At least they're like-minded.
Exactly. Oh, you mean like a partner, like
Yeah,
not
like a
not a
partner.
business partner, like a boyfriend
Well, a
or
business
a
partner
girlfriend.
and a boyfriend or girlfriend.
All right. If you're looking for a date, Nurse Kimberly is looking for a date. Next.
Girl, I think the Lord is working on us. I mean, I see the way that He has moved our revolution, because that's what I'm
Amen.
calling it, man. This is a freaking revolution that is happening. We have all been doing, like kind of our own thing, for the last 3-4 years. But the Lord has brought us together, and we always oftentimes lovingly call it the remnant. And we see where we're at now. It's like we've all been working, but we're synergistically working with one another, and we always have.
Yeah, absolutely. And it's just, the Lord has brought us here, and he orders our steps, and look what we're doing. Sometimes it gets so overwhelming. Like it's so beautiful to watch and to see it all unfolding.
It is. It is. I'm always like looking at him. Here, let me talk about this real quick. I get one of the widows that lost her husband to the deadly protocols. I connected her with an attorney, and that attorney just filed suit and for murder against the hospital system.
Mm.
And she reached out to me and she was telling me about it. And I said, yeah, I heard, I was going to call you. And, and I talked with her. Anyway, long story short, she had to go back to school after her husband died, because she was a nurse for many years and she had to go back to school to get her license. And she's like, this is so hard. And I sent a message to Melissa and I was like, hey, can we get her into Functional Nurse Academy? And she said, absolutely, we can get her in. And she donated the price of the course for her.
That's amazing. We'll send her to Remnant. We'll take care of her as well.
Yeah, I actually copied you into that text thread.
Oh, did you?
So the
Oh Lord,
fact
oh
that
no.
you,
I have so many text messages, Lord. It's in there somewhere.
so
I'll
the
look for it.
well, I already knew that you probably would, so I was like, let's let her get through the program and then we'll bring her into remnant.
Oh yeah, 100%. Absolutely. We'll take care of that. Sorry.
All all right. So now that we've been talking about the last 4 years and how they threw the mask at us, they threw the circles, the plexiglass, the
Mhm.
children that were at home with their abusers,
Yeah.
the children that were not getting fed because they weren't in school, the psychiatric, mental, physical, spiritual breakdown of our society that happened 4 years ago. Well, now 4 years later, you have to wonder why, Kimberly. Why is it that
Every 4
CDC?
years. What happens every 4 years?
Well, every 4 years, yes, we have an election,
Hmm.
and the demonic forces did not want Trump to stay in there, and they put a virus and killed many people, not only physically but spiritually and mentally as well. And so now they're releasing new guidelines for COVID-19. Now um, you do not have to quarantine yourself even if you are actively sick.
Well, they
What?
were doing that in the beginning of the pandemic too, if you remember, with the nurses. If the nurses, there were nurses with active COVID
Mhm.
working on the floors.
Yeah.
So
Well, and you're right. So, before the whole, trillions of dollars were dumped into the system to get people to comply and say, you have to take 2 weeks off. Then that 2 weeks went to 10 days. And then, they just trickled it down once they were getting the injections in people's arms. But also too, remember very early on, well, not even very early on, I think it was in late 2020, early 21, where CDC came out and said that a nurse can be around a symptomatic COVID positive patient performing nursing duties, meaning, getting up in the patient's face, putting in an IV, cleaning them up for 15 minutes before they were considered high risk. Like, what? So anyway, so now they're wanting to come out and say, I think we're in a much better spot because of either the immunity that came from the COVID cases that each of us have had, or the vaccines that
now they're recognizing immunity.
Oh, natural immunity, that's a thing.
Shocking.
Oh my God. Oh, that COVID doesn't pose the same threat as it did during the height of the pandemic, which it says under these new guidelines, isolation is not necessary if symptoms are improving for 24 hours or if you don't have a fever for 24 hours. Oh my God. So we're going back to evidence-based practice of what we've done for decades. If you have a fever, you have to either keep your children home from school or you have to stay home for work for 24 hours while you're fever-free with no medication.
Yep.
What?
Wow.
I mean, I'm wondering what these doctors and nurses think about that. Like and I know the twist that they're going to put on it. They're going to say that it's from the vaccinations, but we know based on virologists, based on evidence-based science, that you can never vaccinate yourself out of a pandemic. Number one. Number two, this mRNA technology was never before used on humans until 2020. So they had no idea what was going to happen. Number three, putting the biologic agent with the spike protein in it, with the lipid nanoparticles, graphene oxide, again, never used before, guys. And to wrap that all together, let's talk about that shot was never even tested to prevent transmission or infection. So how you're going to say that vaccines, the COVID vaccine, helped to get us to where we're at right now? I would like to argue that it caused vaccine escape. And what happened was this lasted way longer than it ever should have.
100%. And people that got vaccinated, they're the ones that have had COVID 3, 4, 5 times. I had it one and done. I'm not vaccinated. I got COVID once and I've never got it again. So, and I was good in 2 days. Thank you, Dr. McCullough, for treating me with some ivermectin, hydroxychloroquine, and all of that wonderful stuff, and getting me better within like 2 days. So, it's not the next.
So it's just, I mean, this is a bunch of BS. That's what I will say. And, for all of you out there listening that knew, that it had a 99.9% survival rate. But that's something that's really not talked about very often. And our kids were not ever at risk. But now we're seeing so many more issues. I just did an interview with the nurse last week, or on Monday of this week, a middle school nurse speaking out against, no, I think that show's coming up. I think we're going to do it on Monday. But yeah, guys, it's like the panic and the fear and these children not having any coping skills. I stress that because in a few years, they are our adults. They are our voting class.
They're not going to be equipped to handle, like you said, the coping skills.
Right.
I've never seen the level of medical anxiety that I have amongst this younger generation. When I was working on the telephone triage line, I would get phone calls all the time. And I've never seen so much anxiety about health related issues and just young people that they shouldn't have a care in the world about this type of stuff, but they are just they're wearing masks everywhere they go. You know, they don't want to leave their homes. It's devastating to watch.
Yeah, it is. It is. And you know, I hope that we really care for this population and help to heal them, because it's been demonic what has happened to them. You know, I did a post this week that asked nurses for advice on my Instagram, and this is what I said. Looking back over these last 4 years, is there any advice you would give to current nurses to help them navigate this challenging healthcare landscape and stay in the field of nursing? Comment below. You know, I received over 100 comments, Kimberly,
Really?
on this.
Wow.
Yes. Yeah, I'm going to read a couple of them. Brandy says, start missing money outside of nursing. I was fired, or start making money outside of nursing. I was fired in 2022. Thank God I had a backup plan and it became my only plan. Over the BS 57 says, do what your heart and not your paycheck tells you. I am getting to the back end of my 30 some years, and teaching ethics to the newbies is hard. Fit to be Lindsay says, was a critical care nurse for 10 years, had my first kiddo at the end of 2019. So went right back to work in the middle of the vid and was like, nope. Thankfully, my husband and I were in a place to make one income work and I could peace out. Definitely learning hard the holistic health side of things and maintaining my license. And if I reemerge into nursing, it will be on the crunchy side of things. So yeah, Fit to be Lindsay received your link and
Thank you.
yes.
Come on over, we're getting really crunchy over here at Remnant.
We are. Somebody else says, I'm not my age, says, yes, get out of bedside and go do some real healing.
Amen.
Gina Marie says, I honestly think our healthcare system needs to burn to the ground.
Oh, she got that from me. Stop it, Gina Marie.
You know, she did. She received 43.
I say all the time.
She received 43 likes on this comment. She says, I was a nurse for 22 years, and knowing what I know now, I have lost all respect for the sick care system we have. Do you think she listens to Nurses Out Loud, or
I
what?
think she does. I think she does. Absolutely. That sounds very familiar, Gina. Come see us.
You know what? Shout out Gina Marie 1273. We love you and we love your comment. She said, goes on to say, there is no saving the system. My advice is to go into holistic healthcare.
Amen.
Yeah. Trixie, Trix RN7 says, I'm still in it, the ER, because I still believe I am making a difference. I educate people all the time, but I am ready to spend my last 5 to 10 years in prep active healthcare instead of reactive sick care. I'm ready to go back to the basics and practical nurses for like-minded people. I stay because of insurance and need for a paycheck at this point. Healthcare is at an all-time low in all aspects. Dr. Gutnut says,
Sorry.
remember Phallus?
Sorry. We're going to cook up Phallus and Dr. Gutnut.
Dr. Gutnut, I love you, girl. She says, I am a DNP. So a DNP is a doctor of nurse practitioner. That is the highest level of nursing that you can get to. I was close to leaving my state due to mandates. They lifted so I could avoid the thing. I almost changed my specialty to avoid things and possibly work from home, but my organization has been doing the right thing, so I stayed. I honestly am glad because I stayed because I want to make a change. I agree with the girl that said we have a sick care system. She's right. I want to end that and go back to the basics. Listen to the patient, assess, eyes, ears, touch, and draw on experience, real science, and knowledge to collaborate care with the patient. What's best for them? I want to heal and eliminate pharma. I don't agree with the 3-letter agency guidelines, and pharma is bad, though. Even if I change one life, I made a difference. I may not be able to change the system, but I'm going to try one day at a time. It's the circus I signed up for, but I didn't agree to allow it to become so broken. I practice functional type medicine in a corporation setting, which is a huge challenge to not get in trouble for not following guidelines. I figured out a better way to help them. I'm a nurse at my core and a healer in my soul. I can't leave it behind. So I chose to stay because I believe in making a difference where I can and promote health and well-being and getting off of meds. So long-winded, but I'm passionate about what I do. Thank you for all you've done, Jodi. Yeah, I mean, we could go on and on with these comments, but we don't have that much more time. But yeah, Kimberly, what do you think?
I think that they all had really good points to make. I really like Gina Marie's, because I say that all the time. I'm like, this system, it needs to burn to the ground. And we as nurses have got to stop, putting out the flames, because we've been doing that for far too long. And let's take our passion, our skills, our knowledge, and let's walk away. And like Gina Marie said, let it burn.
Yeah.
Let it burn.
Amen. I'm going to leave on this note with Lainey W. Firstly, as you know, healthcare has been completely hijacked. If the nurse or doctor is even aware of this, they can start telling the truth and speaking out. It's time for the truth to be told to the uneducated. Amen. Praise God. It's time for us to shine our lights in the darkness, guys. The more the darkness creeps in, the more your little flicker of light will expose it. We encourage you guys to share the truth and to talk, have loving, educated conversations, state your opinion, be quiet. Remember, it's not your job to change people's minds, but it is your job to speak the truth. And until next time, be safe, be well, and God bless you, my friends. Thank you for joining us on this edition of Nurse News Analysis.